So today we're going to be starting a new series. So if you've been on my channel for any time now, you would have noticed that I have several different playlists that some have series on them. And this is going to be a new one named Did You Know? We're going to be talking about two separate concepts that are important or related to medical billing. And the purpose of this series is to learn about terms, concepts, ideas, about two terms that are related to medical billing that maybe you just don't know, never heard of, it's hard to understand, but they're going to be related to each other, and I'm going to go into depth about how they relate to medical billing. So I wanted to thank you guys for subscribing to my channel. We are growing slowly but surely. We're about 2,500, or we're almost to 2,500 subscribers, so thank you very much. Please like the videos, subscribe to the channel if you haven't already, and share my videos with other medical billers so that we can just spread the word about any billing concepts or information. And if you're interested in starting a medical billing business, you can learn a little bit about that as well on the channel. So we're going to start off with the two concepts of billed amount and allowed amount. So the billed amount is the amount that the provider puts on the claim form as the fee for the service that they provided to the patient. Allowed amount is the amount that the payer allows for that service that the provider rendered to the patient. So one is the fee that the provider uses, and the other is the fee that the payer allows. So how are these two concepts used in medical billing? But before I let you know that, let me tell you about the two free quizzes that I have in the description box below. One is for you to find out if medical billing is the career for you, and the second one is for you to find out, are you ready to start a medical billing business? So if any of those interest you, then make sure you take my free quiz. It's short, only a few questions, and it'll give you an idea of if you're ready to start a medical billing business or if medical billing is the career for you. So here are three ways that those two concepts are used in medical billing. The first way is that you as a biller never bill below the allowed amount. If a payer says that they will allow $100 for a procedure, you need to make sure that you never bill below that $100. The second one is that you make sure that you never balance bill. Now, sometimes there's a balance between the billed amount and the allowed amount. And you as the biller need to make sure that you do not balance bill the patient, because that is illegal. Now, if you don't know anything about balance billing, I will link that video that I did about that above. Balance billing is a concept that you should be very familiar with in billing, because again, you don't want to balance bill the patient. And the third way that they are used is that you want to make sure that the allowed amount is the amount that is on the contract for your particular provider. You want to make sure that you are getting the full amount that the payer is saying that they will pay. And sometimes each contract that the provider has signed for a payer may be different when it comes to fees. So you as the biller are responsible in making sure that the fees that are on the contract and the fees that are allowed or are being paid are the right amounts for that particular provider. Now, how do these two concepts relate to each other? I put these two concepts together because with a billed amount always comes an allowed amount. These two terms are always kind of used together. The billed amount will affect the allowed amount. So if you only charge $50 for a service, the payer will definitely not pay any more than the $50 that you billed out. That doesn't mean that they would not allow more than the $50 that you paid out. So I'll explain a little bit about that a little bit later, but the billed amount affects greatly the allowed amount. And also, the patient can get confused if they notice that you billed a certain amount and that the payer allowed a certain amount. So again, if you bill for a office visit and you billed $1,000 for this office visit, and the payer only allows $200 for this office visit, and then the patient gets a bill, maybe they owe a copay and they get a bill, and they see that you bill the insurance company $1,000. Lots of times patients get confused, they get, upset, they think that you're overcharging the insurance, and they don't understand the difference between billed amount and allowed amount, and it can get very confusing for them. So those are two ways that the billed amount and allowed amount are related. Now let's do a little example. We're going to use 3 different scenarios. We're going to use the same CPT code. I'm going to try and make it simple, but just for you to understand. So the first example is going to be that the provider did an office visit, an established office visit, a 99213, and they billed out $500. The allowed amount, however, was $212.13, and the copay was $30. So the insurance pays $182.13. This is an example of if the provider decides to bill out more than what their allowed amount or their contracted amount is. Now, a lot of providers do this because they want to make sure that they don't go below the allowed amount, which is what I said earlier. They want to make sure that they're well above the allowed amount so that they can get as much as they can, or as much as the payer is going to pay them. So most providers do it this way. Now, this also pertains to if you are in network or out of network. And we're going to be more talking about in network because it's a little bit more simpler than trying to discuss out of network and everything that comes with that. So just for you to know, when you're in network with a payer, you have signed a contract with that payer, or the provider has signed a contract with that payer, and they're agreeing upon certain fees. When you're out of network with a payer, then the provider has not signed a contract. And so in theory, they can charge what they want. However, since the No Surprises Act, it's a little bit more sneaky or a little bit more tricky. So you really need to understand how that works. So we're going to more talk about if you are in network with the payer. So in this situation, the provider is in network with the payer, and the provider has to write off the difference between the $500 and the $212.13. Now, the second scenario is going to be if the provider bills out less than what the allowed amount is. So if the provider bills out $200 for the same 99213, and the payer is going to then allow the $200, right? They're not going to allow anything more than what you billed out. So since they billed out $200, even though their contracted rate is $212.13, they're not going to allow that. They're going to allow the amount that you billed out. So they billed out $200, they allowed $200. The copay is still going to be the $30, which is what the patient's policy is. And the payer is going to pay $170. So in actuality, the provider is going to be losing money. So the provider is going to be losing about, $12 or so, $12.13. Either way, if it's a penny or 10 cents or 5 cents and the provider is supposed to get it, then they need to bill it out so that they can get it. Now, the third scenario is if the provider bills out their contracted amount, then the payer is going to allow the contracted amount, the complete contracted amount. So if they bill out $212.13, the payer allows $212.13. The copay is going to be $30, and the payment is going to be $182.13. Now, you might say, well, what's the difference between that last example and the first example? So the difference is the billed amount. And that billed amount doesn't necessarily affect the payer in any way, but it does affect the provider. And we're going to talk a little bit more about that in my next section. Next section is medical billing myths. And what are the myths with these two different terms, billed amount and allowed amount? So as far as one of the myths is that a provider may think If I bill more out, then I'll get paid more. So even though I have a contract with a payer and my contract is for the 212.13, if I bill out $500, $700, $1,000, maybe the payer may pay me more. So that myth is totally incorrect. I don't care what you bill out to the payer. If you have a contract with the payer and the payer says you only get 212.13, then that is the highest amount you could get, whether it is from the payer or from the patient. When it comes to being in network with a payer, again, you sign a contract and you cannot get more money, because let's say you build out more and you want to charge the patient the difference, as we were talking about with the balance billing. So you need to know that it doesn't really matter how much you bill out. It can be an exuberant amount, but you're only going to get paid, or your total payment is only going to equal to the amount that you're contracted with for the payer. And the next thing is that the numbers on your AR report are correct. So you might be asking, well, aren't the numbers on my AR report correct? And it is to a point, or it could be to a point. So the first thing to figure out is, how are you setting up your fees? Are you one of those providers that put on a higher amount than what you're contracted with for each payer? So in this example, are you that provider who bills out $500 even though your contract is for $212.13? Or are you that provider who will bill out $212.13 because that's the amount that you're contracted with that payer for? If you are the first one, then you need to also know that your AR report is not going to be accurate per se. So let me give you an example. So if you have 5 outstanding 99213s on your AR report and you bill $500 for a service that you're only going to get $212.13 for, then your AR is going to say that you have $2,500 outstanding. And you're going to be like, oh my gosh, we're losing $2,500. What's going on? But in actuality, you're not losing $2,500, because when those services get paid, if all 5 got paid, you're only going to get $1,060.65. And you have to write off that difference because they were never going to pay you that anyway. So the difference that you would have to write off is $1,439.35. You're going to have to realize that you were never going to get that money anyways. So you can't really look at your AR report and think that that's all the money that's outstanding and that that's what you should have been collecting if you are one of those providers that do that. Now, I mentioned this because most providers do that. Most providers add on a 20%, or, they do 2 times the amount of Medicare's fee. They make up some type of calculation that would help them get more than what their contracted amount is so that they won't go lower than that. And if you do that, you're going to have to make sure that you reflect that also on your AR report when you're trying to figure out how much is actually outstanding. So if you like this video, then you'll love this video. And I'll see you again in my next one.